We're not an insurance company and we're not a PBM. We are an advocate for consumers that is trying to bring transparency and discounts to Americans so that they can live healthier lives.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we have a very interesting topic to discuss, and it has to do with prescriptions and drugs. We are fortunate to have Justin Fengler, Senior Vice President, Corporate Strategy and Business Operations at Goodrx. I just love that name, Goodrx. So welcome to the Business of Healthcare podcast, Justin.
Thank you, Bob. I'm excited to be here.
All right. Well, we have a lot to talk about today. And I must say that one of the most confusing elements of healthcare, and it's a very important part of healthcare, as you know, is how does this whole pharmacy supply chain work? And it seems very complicated and very difficult to comprehend. And I'd like in this podcast to be able to explain some of the different elements of the supply chain and what Goodrx has done to really, I don't want to say intervene, but to make a difference in that supply chain and create consumer value along that line. So if you don't mind, I'm going to ask a few questions about that supply chain and exactly some of the things that are somewhat of a mystery. How does that sound?
That sounds wonderful. It's very complicated, and there's so many constituents. So happy to talk about it. This is what we live and breathe.
Well, that's good to know because, you know, the typical retail example, if somebody makes a product and they have a distributor for it and there's a retail environment, you go in, you pay for it, and you're done. You know, it's like, what's this cost? You know, it costs $1. Here's $1. Thank you. I walk out the door with the product and I'm done. I don't see that happening too easily or too readily, at least in the prescription business. So kind of bear with me as I kind of go through a little scenario here. I want you to comment on it. So I need a drug. So I go to the pharmacy, I give them my prescription and I give them my money and I leave and everything was simple, right? However, I might have paid a very high list price for that drug. No insurance was involved. I just needed the drug. I had a prescription. I gave the money and I got out. That to me sounds like the easiest thing in the world. So why doesn't that happen very often?
You know, I think it's the interplay between many different constituents that exist in the healthcare supply chain make pricing very complicated. So I think in healthcare, a lot of people might be used to, if they went into the emergency room, they should expect to see a bill with a really high list price, and then they'll see their insurer negotiate that price down. You know, let's say it's a $10,000 bill and their insurance company negotiated to $3,000 and they have to pay $300. I think that people might expect to have something like that. But for a little pill, you might not expect that. But a lot of the same dynamics around the list prices that the pharmacies have to set exist in pharmacy, just like they do in healthcare, where based on the government rules and regulations around, you know, Medicare and Medicaid pricing and the prices that, you know, pharmacies reimburse for them, they have these really high list prices that, you know, that they have to offer anybody that sort of comes in off the street. And then not that many people, you know, end up paying those because they're so high. And then they negotiate with, you know, different insurance companies for drugs. We call them pharmacy benefit managers or PBMs, to reduce the price of those for different companies that PBMs work for, like insurance companies and large employers. But the way in which all of that happens is complicated and not necessarily visible to the common consumers.
Right. So with that thought in mind, let me rewind then, because my first little scenario was, I need a drug, I've got cash, I don't have insurance, I just go in and I pay that very high price. Now I know it's different. Your Goodrx process might let me do the same thing, go in, pay cash, but get a lower price. We'll kind of get to that, but let me rewind for a second. So instead of not having insurance, now let's say I got insurance and I go instead, and now I pay a copay and my insurance company is going to pay the rest, right? So how does that happen? How does the insurance company know that they're going to pay part of it and I'm going to pay part of it?
So insurance companies want you to be a healthy person. They want you to be healthy because that's going to cost them less at the end of the day, and that's their job. So insurance companies are going to create formularies or lists of drugs that are effectively covered that they think are going to drive good health. So common drugs are going to be covered, and they want to make sure that you're going to pay it, but that they're going to end up sort of kicking in more of that price generally. So there's typically a patient pay component, which might be a $10 copay or a co-insurance amount, or if you're on a high deductible plan, it might be a little bit higher. And then there'll be a plan pay amount, and you add those two together, and that's sort of what the pharmacy takes home at the end of the day. All of those are designed in complicated ways to make sure that people aren't taking drugs that they shouldn't be paying, or maybe discourage people from taking really expensive drugs that the plan might have a cheaper option for. So there's all sorts of things around high deductible plans, formulary exclusions, prior authorizations, quantity limits. It gets really complicated really fast. And that's where Goodrx comes in.
I can see it does. I can see it gets really complicated really fast. All right. So we went through one scenario where I'm paying cash. Now I've got the insurance and we had this co-payment. And then the pharmacy, they send this claim off to the insurance company then. And the insurance company, they decide how much they're going to pay. The insurance company makes that decision, and then they send me the balance back to me. And so I go in there and I get this drug, I pay the copay, the pharmacy sends off the thing to the insurance company. The insurance company says, hey, we covered a lot of it, but not all of it. You got a little bit more than your copay. You still have to pay some more. And so I do that. So the big question becomes, how does the insurance company know how much they're going to pay? And you mentioned this thing called formularies. So why don't you unpack that a little bit for our audience and explain, why do these formularies exist and what do the different levels of formularies mean?
Yeah, so a formulary is essentially a list of drugs that an insurance company is willing to pay for. And like I said before, it gets complicated fast, and it's all designed to keep people healthy. But in doing that, the insurance company is also trying to manage cost for their end client, which is the plan sponsor. And the insurance company creates lots of different mechanisms, just like in the medical side of the house, to make sure that people aren't taking drugs that maybe are too expensive and, maybe aren't taking too many. So the good example that I like to use is if I'm walking onto an airplane, probably every person on an airplane paid a different price for the seat that they're sitting in. And I think that if you stand at the pharmacy counter, it's something pretty similar. I think every single person, even if they're filling the same drug at the same pharmacy, tends to pay a different price based on the insurance plan that they had. So it's impossible for the pharmacist to predict what the price is going to be for the next person in line, because maybe for one person, generic Lipitor is covered on a $10 copay, and the next person that has the other insurance plan is paying $100 for it because they're on a high deductible plan with a separate pharmacy deductible. There's not a whole lot of rhyme or reason or ability for a consumer to really predict what they're going to be paying. And, it differs by pharmacy, it differs by drug, it differs by time of the year and how much you spent into your plan. Unlike other areas where consumers are used to price transparency or used to knowing what they should pay for their television or, their paper towels. There's not a good way for consumers to do that. And even if they could, it can be complicated. You're looking at a little sheet of paper that your doctor wrote for you, and you don't really know how to spell the name of the drug, and you don't know, what the quantity is. And you're having to click through 15 different buttons to try to get a number that's probably not right. That's where Goodrx comes in. We try to make it incredibly simple for people to know exactly what they're going to pay at the pharmacy and get them a price that they can afford. Okay,
so when we think of formularies, then we should think that the people that create these formularies are the insurance companies. And the reason they do that is they want to choose the right kinds of drugs to make available that they want to cover through their insurance reimbursement. Now, is it true that there's different levels of formulary, tier 1, tier 2, tier 3, et cetera? And would tier 1, would it have the lowest copay, and it would be lower than the tier 2 copay, which would be lower than the tier 3 copay? So those copays are related to those formulary tiers?
Yeah, so on any particular drug list or formulary, which is usually created by the pharmacy benefit manager, and then they're partnering kind of with your health insurer, there are different tiers of drugs that are on there. So there's the very cheap drugs, and those might be tier one. Then there's a little bit more expensive; those might be tier two, and then there's tier three, four, five. Some formularies even have 6 different levels of payment that you have on them, and it can go anywhere from call it $10 to easily over $100. But I think that the thing about tiers is the plans are so complicated now with not just copays, but co-insurance and deductibles and in-network and out-of-network that what might be convenient for one person in the plan because they have a CVS next to their house, that might have a lower copay or a lower co-insurance than the Walgreens that's across the street. And the consumer doesn't really have a good way to know that.
Okay.
So it gets really complicated really fast.
Okay, so I'm gonna fill one last piece of the puzzle together. Then we're gonna get deeper into what Goodrx does, because I'm trying to lay a foundation here,
sure,
so people can kind of understand some of these things. So far we got the pharma, the person that makes the drug, and we've got that wholesaler that basically gets it to the pharmacy. They buy them in bulk and get them transported over there, and then we got that insurance company that's going to have these formularies. Oh, we got the consumer. We talked about the consumer. They're going to either pay the high price or a lower price or a combination of some type of pricing. But we haven't talked about the pharmacy benefit manager yet, the PBM. And so I want to try to get a little framework around the PBM. And here's a high level perspective. And I want to see if you think this is the way it works or not. So you've got the PBM, and what are they wanting to do? They're wanting to get the lowest prices they can for who? Their employers and their insurance companies. So they're kind of like an advocate there for the insurance company. And on the other hand, they're going to go to that pharma and they're going to say, hey, we want a discount. We want better prices. So they're between two groups. They're between the employer or the insurance company and the pharma. So I will call them a middleman or middle person, if you will. And they negotiate. They go in there, I believe, and negotiate with the pharma and say, give me a better discount. And they're doing that because they want to get a lower price. Is that how you see that working too? I just want to, if that's not the way, if there's more to it, I want you to kind of go deeper on that if you can.
Yeah, so I think that pharmacy benefit managers or PBMs, they're essentially handling the pharmacy part of the benefit for any plan sponsor. So an insurance company or a self-insured employer is going to, they'll probably have an insurance company or kind of their core part of their plan is managing the medical benefit. And then this, separate part of the benefit, which is the pharmacy benefit, is going to be managed by the PBM. And what the PBM is going to do is they're taking the power of the quantity of people that they have under their plan. So they're working with lots and lots of different plans and lots of different employers. And the power of that large population enables them to get better rates from the big drug companies for particularly expensive drugs. So if we take a step back, there's kind of 2 types of drugs. There's brand drugs and there's generic drugs. And brand drugs are typically where people are focused because that is about 75% of the cost. But brand drugs are only about 10% of the drugs that are dispensed in this country. So they're disproportionately expensive. And that's where, quote unquote, big pharma or the pharmaceutical manufacturers come into play. And the pharmacy benefit managers do their job is to essentially reduce that price based on the power of all of these people coming to the table and negotiating collectively. And then on the generic side, there are lots of different manufacturers that are making generic drugs. And that's 90% of drugs that are dispensed in this country. So the vast majority of drugs. And the pharmacy benefit manager is negotiating with effectively the pharmacies to get less expensive rates for those drugs for the plan sponsors at the end of the day. So they're sort of sitting between 4 different constituents: the patient, the pharmacy, the insurance company or the plan sponsor, and the pharmaceutical manufacturer at the end of the day to create a plan, a drug plan that makes sense for people and that is affordable to the plan sponsor.
So they are the supreme negotiators then. They're working with everybody, it seems.
They're working with everybody. Yeah. That's right.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
I think we've covered all the supply chain elements. We've got the pharma, the wholesaler, the insurance company, the PBM, the pharmacy benefit manager, and the consumer. What is Goodrx? Are you an insurance company?
Goodrx is not an insurance company. I think maybe it would be helpful for us to talk a little bit about the history of the business, and
yes,
and I think that will kind of give you a perspective of how we view the market and how we view the consumer.
Perfect. Let's do that.
So really the company began based on personal experience. So our founder, Doug, who is the head of product at Facebook and Yahoo previously, he's not a healthcare person. He's a consumer internet guy. Went to a pharmacy for a prescription and was quoted $400. This is back in 2010. And, he thought that was pretty expensive. So he went to another pharmacy. They quoted him $300. And then went to a third pharmacy, and the pharmacist started negotiating the price with him at the counter, which is pretty curious. So when you think back to 2010, when you Googled the price of a drug, you came up with nothing. And that's contrary to other categories like clothes or plane tickets, where you had, more responses than could fit on the first page of Google. So that really got us thinking, what is the price that people should be paying for drugs? If we're having trouble affording them, I'm sure lots and lots of people are. So it was almost more of a research project than anything else. And, fast forward 10 years, and we've partnered with essentially every person in the pharmacy ecosystem with a mission of getting Americans the healthcare they need at a price they can afford. So we view ourselves as a marketplace and a consumer internet platform that helps people understand the price that they can get for the drugs and gives them a mechanism to go get drugs at an affordable price.
So you're not an insurance company. You're not a PBM either, are you?
We're not an insurance company, and we're not a PBM. We are an advocate for consumers that is trying to bring transparency and discounts to Americans so that they can live healthier lives.
So you're truly consumer focused, and you're really it sounds like a digital healthcare platform, a marketplace that facilitates helping consumers shop and become educated and aware of their options, right?
That's exactly right. I think that many people would agree that healthcare is far too expensive for many Americans. And a lot of people have to choose between filling their medications or getting healthcare and, items like food and housing. And that shouldn't be the case. If you hear any political debate or anything, the issues of affordability and access are ubiquitous across the country. And, we're using our platform to do our best to tackle that, not just in healthcare, but also in areas of telemedicine, where we have a platform that serves many common conditions. I think one crazy thing about telemedicine is the average time to see a doctor in this country is about 25 days in most metropolitan areas. And for over 40 conditions, we can get you same day prescriptions and sort of reduce that access barrier. So I think that it's not just on the drug side on affordability, but it's also an issue of access. And we continue to expand upon what we do to serve consumers even better.
Well, Justin, that kind of fits into the determinants of health, the social determinants and health equity. Those are very, very important concerns today. And how do you guys play into that area as well? It sounds like it's a natural fit.
The core of our company is really focused on improving access and affordability. And we live that both through the product that we've created, but also through some of the charitable work that we do. So I think that this has been all the way back to Hurricane Harvey in Houston. We sent people there to help people get the drugs that they needed. We sent care packages to frontline healthcare workers during COVID. And frequently we just help those who are reaching out to us who are in need of healthcare affordability. And as a part of our IPO, we actually launched an initiative called Goodrx Helps, which is a philanthropic initiative that provides free prescriptions and care to patients who need it. So we dedicated more than 1 million shares valued at about $40 million to fund Goodrx Helps. And our first initiative for that is working with the National Association for Free and Charitable Clinics, the NAFC, to provide free medications to those who are unable to afford them. So we continue to live that and build upon that as really core to our business.
So as a marketplace, it's way bigger than just the transaction of fulfilling and getting pricing on prescriptions. I'm sure that education plays a big role. And, there's a lot of problems if you just kind of back up from the fact that people need to get their drugs, the usage of drugs, adherence, people using them the right way and, staying currently educated about that. Does that fit into your marketplace too?
Absolutely. So we have a team of researchers, PhDs, healthcare economists that are constantly looking at healthcare affordability. We just published a report called the Goodrx Effect, which further quantified the impact that we have on the American healthcare system. And, really it all starts with savings and helping Americans save on their prescriptions. And we've saved Americans over $30 billion since we started over the last 10 years. And this is an environment where 37% of people are struggling to pay for their medications. And a third of adults find prescriptions that are prescribed by their doctor are not covered by their insurance. And, those savings really drive better adherence. I think that our data shows, and this is through our healthcare economists and through our research organizations, that 78 million prescriptions have been filled due to Goodrx for patients that otherwise wouldn't have been able to afford them. And I think most researchers agree that medication adherence is, significant, has a significant impact on just the overall healthcare system. Non-adherence costs nearly $300 billion a year to the healthcare system and is estimated to cost the system over 100,000 deaths, which is, really, really sad. And we're just trying to overall improve outcomes for Americans by getting the prescriptions that they need into their hands, so that they can have affordable healthcare at the end of the day, and really so that they have to make fewer hard choices. So by freeing up funds that they're using for previously really expensive medications and healthcare, they can now, better afford healthy food and housing. And that's really core to our mission.
We all are aware that change is inevitable in our current U.S. health system. Change is happening unpredictably, actually. We can't really control everything that's happening, but we see things that are starting to emerge as important consumer issues, and educating the consumer is important. Pricing transparency is becoming an important issue. We teach a lot of these value-based pricing, value-based lessons here in quality, et cetera, in our program at the university. And when you see something disruptive take place, they're in Oklahoma, the Center for Surgery in Oklahoma, they publish their costs down to the penny. If you have a shoulder that needs to be replaced or a knee, they tell you exactly what it is. And that's pretty disruptive because, it takes away the mystery on these well-defined procedures, and people kind of gravitate towards that. And I can see the same thing happening in other areas of healthcare, but particularly the prescription area, that when people wise up to the fact that there are alternative ways, and you're not any of those people in the supply chain that we went through, that we rigorously went through and kind of decomposed. You're not any of those. You're really on top of that or around that or in that. You really have a different perspective on that. And I'm sure that's going to be more change directed in the future, especially along the line of transparency. So I've seen your commercials on TV. I've always been mystified. I go like, how does that work? How does that work? And I have a much better idea now. So just for the benefit of our audience, if I walk in today, and I have insurance where I work right now, but if I walk into a pharmacy and I provide a prescription and I look at that and I'd say, my insurance covers it, so I'm not going to think about it. I'm not shopping on it. If I have bad insurance, I might have a different approach, I would think. I'd say, I need to check this thing out. So what's it take to get somebody to check out what Goodrx is all about? Is that is that the magic wand or what?
It's interesting. And still 70% of Americans don't realize that the price for their drugs can vary. And I think they don't really have an expectation of what they'll pay at the pharmacy. So you've seen our commercials. Obviously, I think that we like to say our biggest competitor is awareness, and making more people aware that, they should be checking us, even if they have good insurance. A lot of people think that they have good insurance, but we can usually find them a better option. Certainly people that are on high deductible plans or maybe are taking drugs on a regular basis, it's definitely worth it for them to check it out to see, if it makes sense, and we can help you. And, there's a lot of ways in which we can do that. We obviously have our regular product, which is free, but we also have a product called Goodrx Gold, which is a subscription product that gets you, your prescriptions for even less money. So we're continually trying to find ways to make healthcare more affordable and to address this issue more broadly.
Well, Justin, this has been a great conversation with you. You've really shared with us a lot of the insights and help us understand better what is required to make better choices as a consumer in the healthcare space. So we appreciate that. Continued success to the company. We were glad to see your IPO last September. And I know it's a different company now because of the momentum you've created and the consumers that you're addressing. So thank you for being part of the Business of Healthcare podcast today.
Absolutely. Thank you, Bob. This has been a delight.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.